anytime I hear burnout being a really important part of somebody's story, I'm just reminded to slow down and to honor that part of the story, because very often it's that burnout and that numbness and that pain and that longing that ends up being this incredible fuel to get us to the next step of where we're going. What's up, nurses and nurse coaches? Heather here. Welcome back to the Nurse Coach Collective podcast. Joining me today is Nicole Lohonen, an amazing nurse coach. I cannot wait to introduce you to her. But first, Nicole, welcome.
Thank you, Heather, for having me.
Let me tell you about Nicole, who is a registered nurse with over 14 years of experience who became burnt out at the bedside. Seeking a better way, she stumbled across nurse coaching. Experiencing a personal revival, Nicole is now on a mission to transform bedside nursing by bringing nurse coaching to nurse the nurses into the hospital environment. She's currently building a nurse coaching department within her hospital system. With the ripple effect of happy, healthy nurses showing up to work motivated and inspired, living as examples of health, Nicole is passionate about leveraging nurse coaching to transform the health of communities and the patients that we serve. Nicole, what an honor to have you here.
What a wonderful intro.
You deserve it. So, okay, one of the things that really stood out to me in that introduction here is this idea of being on a personal revival that you have experienced. What does that mean to you exactly?
It was a little unexpected. When I found you guys scrolling Facebook,
as one does.
I saw, your video. I was like, oh my gosh, this is exactly how I always pictured practicing nurses. And at that time, I was very burnt out. So along the way, which I wasn't necessarily expecting to kind of get that personal revival, but I ended up just having that, shift in mindset, new perspectives along the way in the course. And that just, all of a sudden I was coming to work different. I was, looking at it with a renewed sense of energy that I didn't have before. And when I was doing my practicum hours, I, had my coworkers hey, anybody want to volunteer? And I actually got quite a few of them, were my pro bonos. And that's really where I was like, wait a minute, this is helping me, even coaching them. I was seeing that, renewed sense of purpose and energy. So that was really my major shift, I think, through the collective was there's something here, something I've always been missing. And there was a moment that I think I was about halfway through the collective because I'd started my pro bonos. And I said, oh my gosh, this is what I was born to do. I had it all wrong nursing before. I knew I was a nurse, but it was that moment that I was no, you're born for this type of nursing.
I love that. It's like you weren't wrong, right? You were born to be in the nursing profession. You just hadn't quite found that place where it was going to click and feel oh yes, this is it. Yeah, how cool. So did you know, when you got to that point in the course and when you started your practicum and working with pro bono clients, did you know coming into this that you wanted to be working with your fellow nurses or supporting your colleagues in that way?
I think just experiencing it personally and just knowing wait, I have something to give people who are in my shoes. And there was a point too, I was very private practice focused, going through the collective. I was this is my magic way out of the hospital. But really I was let me do some good on the way out. And that was really kind of what my focus was. And then it just 180'd. But yeah, I think just going through it personally and just really nobody knows the mind and heart of a nurse better than another nurse. And we are so able to support each other through this type of work. And so that really became my passion. We need personal restoration with our healthcare professionals because we really should be practicing what we preach, modeling it. And I think we forget how to care for ourselves. And I wanted to do that for them and nurse the nurses.
And for yourself too, it sounds like. I mean, let me repeat back what I'm hearing you say, which is that like when you discovered nurse coaching and you were excited by this other possibility, it sounds like at first deeply embedded in that excitement was this idea of like, I can leave the bedside, I can leave the hospital, I can start a private practice, and it's almost like this way of escaping. And then as you were navigating your journey, you had already starting to have this shift of like, okay, wait, who can I serve? What do I need in this moment? What do the people around me need in this moment? And then getting to a true realization of like, but hold on, where I am right now is actually somewhere that I can be of tremendous service and needs a whole lot of work. Does that sound about right?
Absolutely. You're right on. And I've said that a lot, when sharing about my journey, is that it was an escape route. Like that's what I was doing. And when I recognized that, I was like, well, why am I escaping? I'm escaping because the environment and because our bedside nurse environment has taken us so far away from that patient relationship that we all get that deep fulfillment from, and into behind the scenes and tasks and all of these things. And just, well, that's what I'm really escaping, is those things. What I really love is that relationship, because that's really where healing is that relationship.
Tell me more about that, because this idea of wanting to escape from the bedside or wanting to escape from nursing, if that's how you best understand it in the moment, I think is a sentiment that pretty much every single nurse who I know at this moment in time has experienced in some way, shape, or form. And so for you, and for me too, but for you, from what I have gleaned, like that looked like a lot of burnout. So I'm curious, right? Burnout comes in thousands of different shapes and forms for each of us. Like, what was burnout like for you? Like, what did it really feel like to be a nurse at the bedside, feeling like you were robbed of your ability to connect with human patients, and that's where healing lives? Like, what was that experience like?
I guess I've never been asked that kind of question, but thinking about it, raising two little ones, I have 5 and 7-year-old boys. And at the time, they were still very young, requiring a lot of time and energy at home. And I was seeing how over time, like in that burnout with the patients, it was like almost like you get a little hardened, like I mean, the compassion fatigue, right? That's what I was really experiencing. It was like, let me get in, get my stuff done. Hopefully I'm not here till 9:00 at night. And then do I have anything left for my family? And it was just, it was like, I'm not even enjoying this anymore. And like, where's my love for nursing? Where's my passion? Like, it was like there was no joy in it. And that's really what I wanted back, was first coming to nursing and you're so excited and you're going to change the world, right? One patient at a time. But really, it was all of the home stuff. It was years. I moved across the country. So I'm from Minnesota originally, came to Florida. So even that alone was like a big culture difference that I never could really put my finger on. And, over time, I found a good organization to work for. Every organization has its issues, but I think just overall, like it was like definitely not what I experienced up north. And I was like, why is this so different? And I think that was a major contributor to burnout, because my initial experience with nursing and then moving across country in a totally different, we have a huge elderly population here in Florida, lots of retirees, lots of complicated, high acuity, and lack of self-care definitely led to burnout. Giving and never giving the same to yourself. So never nursing yourself.
Okay. So I'm starting to see where the threads are weaving together to how you eventually tied the escape into then what has become now your passion. But let me go back here and see if you can make this a little bit more real for me. So you are feeling this sense of disconnect with your patients. You're feeling a total kind of culture shock from moving to a different part of the country and a different type of medical system, a different population. You're coming back to your family with your two little ones, feeling depleted. You're feeling this compassion fatigue. What did that mean for you in your life and who you became as a person? Like, how did that impact your family? How did that impact really everything?
Well, in that burnout state, I was, seeing how it was really affecting, like how much burnout can affect relationships at home, like how we try to leave work at work, and I think, pretend sometimes that we can do that, but that's the effect. Like, you're more irritable, little things annoy you, like kids are just being kids, and yet you're like, mommy is not, cannot right now. Lack of sleep, just never feeling like I can get anything done around the house, or I'm spending all my day off when I'm already exhausted trying to clean and do laundry. And it just, it led to, in some ways, burnout in the family too, right? Like, why am I always caring for people? Like, who's going to care for me? And, just even with, relationship with my husband, like, it's only us here. We have no one else. All families in Minnesota. So we had to really lean on each other. So there was some friction because, I wanted him to do stuff, to help me, but yet he's busy too. So it was kind of a like, you do your thing, I do my thing. And we really weren't like working together as a team. So that's kind of how it trickled down, and it even just fed it more like at work. It got harder to go to work. And I just, was like, I want to just really give up and quit. But what else am I going to do? I'm a nurse. I can't picture doing anything else. And the only way I saw out was that, okay, if I want to practice nursing the way I want to, I'm going to have to go back to school and get, a nurse practitioner and spend all this money. And I was like, there's got to be some way. And again, just so happens, scrolling one day, I find your video. And, I was like, this is exactly what I'm looking for. And I don't have to go to school forever. And it's a financial investment, yes, but it was so worth it.
But what's the cost of not doing anything, right? When you're in that dire state of feeling so burnt out and in this vicious cycle of like, what's happening at work is making things worse at home, and then what's happening at home is making things worse at work. Like, you really get stuck. And Nicole, I so appreciate you sharing a little bit more on what that really felt like, because, my own personal story of burnout was pretty ugly. I mean, it was pretty messy and raw and so painful at some points. And I didn't talk about it a lot then because I felt a lot of shame around it. I felt like, I've only been doing night shift for 3 years. Who am I to complain about this? And who am I to be having these feelings? But they were so big and so real, and the toll that it was taking on my health was so real. I didn't talk about it very often. And then now, fast forward to today in the nurse coaching world. And again, I don't talk about it very often because it feels like a lifetime ago. And it's so far from what I feel in this moment in terms of being engaged and being fulfilled and loving the work that I do. But anytime I hear burnout being a really important part of somebody's story, like, I'm just reminded to slow down and to honor that part of the story, because very often it's like, it's that burnout and that numbness and that pain and that longing that ends up being this incredible fuel to get us to the next step of where we're going. Does that resonate for you?
Oh, yes. I was real low. I was at a real low place. And it really was hopelessness, because, you feel this trapped, like, oh my gosh, this system is so huge, and you're one little nurse and you're going to say something and nothing's ever going to change. That is a huge mentality. Unfortunately, that's very prevalent, that nurses are not able to affect change the way they want to. And so through working with them one-to-one, I've been able to kind of shine the light a little bit and say, no one's coming to save us. Okay. They've tried, administration. Here's some wellness stuff, but it doesn't work because we roll our eyes and we're tired. We're disengaged. We are hopeless. We're like, oh, that's a cool idea. But really, again, in the coaching world, if the idea doesn't come from you, how likely are you really going to do it? If it's somebody else's plan, you're probably not going to follow through. So flipping it around and like, guys, no one's coming to save us. We need to step up and create what we want our workspace to be like. And with a lot of division, with frustration, with burnout prevalent, it's, kind of well, I'm going to do my assignment and you do your assignment. And there's not a lot of like, where did our family environment go? Because I feel like it once was. And part of on our unit specifically is they built a whole new big giant wing, 100 new beds. We're orthopedics. So we got to the new unit and it was so beautiful for patients, but so not functional for staff. So it really was oh, you're here today? You were way on that side and I didn't see you once. And so it was really hard to get that team. And so it felt like it just kind of fell apart. And that people were like searching to get out of here, right? And we just needed that, how do we come together again? So we'd have little activities that we do, like my manager, she's amazing. She started like a book club. So we have like, little activities like that. But it was really kind of a desire to give back to our staff one-to-one that I had received, even just going through this and being coached myself and getting that fire lit again and that passion for life, for, wait a minute, like I have a choice here. I can look at this situation or these conversations this way or that way. And it's really comes down to, what do I want? And it doesn't have to be this way. And even if nobody else is on board, I can still be the light and still be the inspiration. You don't need to work one-to-one with every single nurse, but the ones that you do, they start changing and then you get that ripple effect.
Yeah, and you get to come from that place of empowerment through your own personal choice, your choice to show up a certain way, and then your choice to support another nurse and another nurse's choice to accept it or not be ready for it or be a part of it or say, not yet. And it makes me laugh when you talked about, maybe the administration or the managers try to sprinkle in a little bit here and all the floor nurses are over there just like rolling their eyes. And I remember being in nursing school, I actually had I won't say it was a class, but maybe it was like a day or two of a class where they talked about self-care. And we had the PowerPoint that was all about how self-care is so important. And now today I'm like, self-care is so important. And I'm shouting it from the rooftops. But at the time, you have this room full of, tiny little novice excited nurses who are excited to start doing the skills and the IVs and all the technical stuff, that we are sitting there rolling our eyes because you don't really know that you need it until you need it. And then by the time that you need it, it's really hard to take any ownership or to feel empowered and inspired to create it for yourself. So I totally resonate with what you're saying here. And what I'm curious is how are you able to take your perspective now and share that with your fellow nurses and your colleagues in your department? Because not every nurse that you are exposed to is coming from the nurse coaching lens or has, been through a program like this to have the background that you do.
I had a opportunity to, do a pilot program last year around this time, specifically with new nurses, but I had experienced nurses and, assistants and techs as well, but they were kind of a separate group. And so then over time, we kind of got like word around and a little busier. So I had the chance to kind of like step further and further away from the bedside. And I feel like just having that little bit of break, it like almost like broke the trance from my eyes, in some ways. And I was like, wait a minute here. And I just was able to really open, like, you hear, yeah, you got to take a break. Yeah, you got an uninterrupted break. And like people are so attached to their phones. There's no way I can put my phone down. Like you're just so in it that you cannot step away mentally, even though you should. And having that opportunity to kind of step back a little bit, it was like almost like my eyes opened even more. And I was like, wait a minute, this is kind of like a patient safety issue. Like, how can we look at self-care as really like, and just reminding myself that the nursing code of ethics, actually, there's a provision in there too, like do to yourself as you would to your patients. I'm like, we don't do that at all.
Yeah, Nicole, Peter always laughs at me because I always bring that up. I'm like, it's right here in our code of ethics.
Yeah, and I like remembered about that like recently too. So it was like I'd been doing this for a while. I'm like, wait a minute. I know there's something in there. Basically walking your talk, and how is this really a patient safety thing? And I give the example of, okay, we've all been at the bedside and you're starving, you're so hungry you're going to pass out and your bladder is going to burst. What are you normally doing when your patient's talking and you're in that state? Your brain's like, get me out of this room by any means necessary because I need to go eat something before I die or pee before I pee over this floor.
Yeah, or both at the same time because you only have 30 seconds. So you're like stuffing saltines in your mouth while trying to pee and not touch anything. I've never done that.
Oh, wait a minute. Your brain now is split between your own physical needs. Your attention is not 100% on that patient. And if that patient is trying to convey something that's probably like maybe subtle, but like very important to their care and why they're there, and something that maybe you need to relay to the physician, but you can't hear it because you're not able to in that moment. And so if you're really not taking care of your physical needs, same thing with coaching, right? How can you be fully present for the other person and really provide your, really good care? Because you know what it's like when you're like, oh my gosh, my brain is all over the place because I haven't had a mental break in 10 hours. I haven't eaten. And so I feel like we really need to start breaking that culture, or almost like a badge of honor. Oh, I haven't taken a break today. I am so busy, right? This busyness.
I've worked like 9 shifts in a row.
Oh my gosh, yes. Like, but you're choosing to, really.
Interesting. And so, yes. So, and it's not a perspective of, right, like blame or pointing fingers, but it is a perspective of how can we take personal ownership and personal responsibility to do better by ourselves and for ourselves. And that's really interesting. And I think that could probably feel challenging, for somebody to hear that, but then also through a different lens could feel very, very empowering when you recognize, oh, there are different choices that I could make, and maybe even more hopeful when there's somebody like you in their corner to be like, oh, and I can have support while doing this and while making these shifts. And I have no doubt in my mind that like every single nurse who is listening to this episode is going to be nodding their head on a lot of this stuff that we're talking about, right? Which is like those badges of honor for working shift after shift after shift, for working 16 hours in a row, for not peeing or eating for an entire 12 hours, right? And it's not because really we think they deserve a badge of honor, but it's because we have accepted them as just part of the job. And so in order to be good nurses and to be good at what we do, we have to do those things, and we can't like put up our boundaries and say, yes, I'm taking a break. Yes, I'm leaving my phone. Yes, I'm taking time for myself. Yes, I'm going to the bathroom, as simple as that can sound. So this is all alluding to like why the work that you're doing and why the segment of nurse coaching and hospital nursing and melding those two together is so incredibly important. I mean, truly vital. So I feel like, Nicole, we have been like talking kind of about this and around this without necessarily diving into the details of it. But that's what I want to know more about. Like, tell me, what does it mean that you have built a nurse coaching department at your hospital? Like, that's a huge thing to say. What does that actually look like in real life? And you did that within a year of graduating from the Nurse Coach Collective. Is that right?
I did. It's crazy. We're not done building it. We are baby building it. But again, it started with this, oh, let me make it better on the way out. Because I was full on to private practice and I, had my own coach. And I just remember her saying, well, because I was wrestling with like, well, do I do this or do I do this? I have an opportunity and I kind of want to make things better. That's why I'm escaping. But I also want to like the benefits of being free, right? And yeah, it just kind of, she was like, well, can you do both? And I was like, well, I guess I could. And, at the time I had, had said something to my manager, like, hey, I'm, during the collective, like, wheels are turning. I was like, well, I was suffering from burnout, right? And hey, I think this is something like I would like to kind of like coach our staff. I feel like that could help revive us a little bit, with the self-care. Like happy, healthy nurses show up to work differently, right?
They do.
And so, yeah, we got the, it just so happened that was kind of one of our hospital goals anyway, was wellness of team members. And so, having the opportunity, having to make that personal decision, like, well, I really wanted this, but this is a little bigger and it's more, it was scarier. And so it required a heck of a lot more faith to do this work. But I started thinking like the benefit really is happy, healthy nurses come to work differently. Patient care looks different. Maybe we inspire through mini coaching, 10-minute conversations with patients. We have different ways of communicating now, right? And these coaching mindsets and principles can be instilled just by having these conversations. Wouldn't it be amazing to, hey, this could be totally full circle. Patients start taking care of themselves. Boom, there goes our acuity issue, right? And maybe there's less complicated stuff. Maybe only the people that really need to be in the hospital are. And just seeing the longer, like, what if we expand this to outpatient? What if we partner with our outpatient physicians? What impact could we have in the community? And everyone, right, from birth to death, at some point in your life, you're going to experience the care of a nurse. We're the largest part of our healthcare population. We do what nobody else does. We are a special breed, and we can't all leave. So bringing those kind of truths to administration, having the support of our CNO, go ahead, do a pilot program. We were seeing new nurses within 6 months to a year, just as burnout was off. Like, wait a minute, what's going on? If we have these wonderful new grad programs and they're all going through it, why are they falling into, like, being sucked in basically to where everybody else is at? Like, they're fresh. Like you mentioned earlier, I'm only 3 years in. What is going on? And it's really that lack of support, right? That lack of like, this is a mental, physical, emotional job. And we're, a lot of times dealing with it alone. Or, yeah, we have employee assistance, but we don't take the initiative to do. Or you call and you can't get through and then you're like, forget it, it's over and done with. We experience lots of traumas, workplace violence. That's a whole nother side of what we are doing in our hospital that coaches are involved in. So we started with the pilot program, the new nurses. We said, what if they get paired with their preceptor, the first 12 weeks, but what if they get paired for a coach from the beginning for their first 6 months? So that takes them through the preceptorship. We're kind of working out, like, how's it going on the floor? Are you vibing with your preceptor? What are you experiencing? How are we taking things from nursing school, those big fear of harm, right? They come out of that with just post-COVID, and clinical experience has looked different. So they aren't getting as much hands-on. So there's like a lag, then of, feeling comfortable and confident and, doing when they first come on. So we're really seeing like that 3 to 6 months, traditionally like, okay, you're done with preceptorship. Now you're done. You get 12 weeks and now you're on your own. And you try to get support from your coworkers, but we're busy, it's like quick, but like, then where do you go to like as an outlet? Can we provide that for all the emotional stuff, all the, that's a life transition. It's like getting married, having a baby, starting your nursing career has a huge transition and it's lengthy, right? It's not just like all of a sudden 6 months in and you're golden. It's like a year, 2 years, 3 years even. So we really wanted to support them there. And then what about everybody else? What about me, right? Where I was in that state. So we kind of simultaneously said, let's offer that to our nurses and bedside staff. There's something very powerful about the peer. They might talk to their manager, but they're not going to be as open because they're more vocal and they're more like, they know you walked in their shoes. They're more, it's a safer place for an outlet. So we simultaneously did those two things. I did a pilot program with the new nurses and then everybody else, we did surveys and like, it was kind of a really like in your own words. And every one of them were like, this is a great outlet. I'm thankful for, I would love for this, if this service were offered to you, would you continue to use it? And most of them, yes, I would. So we got to bring that, last December, here's all of our data. Here's what your people are actually saying in their own words. And so then we said, well, okay, you're the only one in the hospital. You can't serve, hundreds of staff alone. So how are we going to expand?
Okay, great. So this is good. We're already thinking about expansion. They're already recognizing the value.
Absolutely. And it was like, okay, so we looked into tuition reimbursement and it was like, oh, well, that doesn't really fit. Our current policy didn't really fit with, this type of program. So they said, let's rewrite that. First of all, let's get NCBCE authorized to for reimbursement because they give certified nurses bonuses every year if you're certified. So they really encourage that. But Nurse Coach wasn't on there. It is.
Yay.
And it's now. It is fully reimbursable. So to get around that, we said, let's go to our hospital foundation. Let's ask for a grant money. And let's see if we want to send 10 nurses through a program to get trained as nurse coaches. So we did. And we said, okay, so we have peer coach. We can serve anybody, but I've never worked mom baby. I haven't worked ER. Maybe they're best powerfully served by somebody who knows that workflow, right? So we have an ER nurse who's getting trained. We have mom baby, labor and delivery, most of our med-surg units, and then nurse leaders, right? Like they have their own stuff. And right now there's this divide between bedside and leadership. And so we've been able to kind of be like a bridge in some sense. So we have a nurse manager who's getting trained so she can support at the leadership level. And then my director who has been so instrumental in helping pull this forward and getting the grant money secured. She just finished too. So she just has to take her boards, but she can support at the executive director level because again, with that peer level, it can't just be here. It has to be all the way down. It has to be top down. So that's really what we're doing. We just graduated a total of 7 of us. And then there's me. And I actually hooked up with one of, along the way, there was a nurse on another unit while we were kind of spreading the word, recruiting people. Oh, this person's already going through the collective. And so we're like, oh, so we got connected and she just graduated in May. So she has the 3rd floor, kind of building that out. I'm building the other one. So it was like, oh my gosh, we just happened to be in the same hospital.
We're everywhere.
Yes, which was great. So now I had my partner in crime. So it was us 2. And then we just graduated 7 others. So we'll come January, we're kind of now at the, okay, what's mom baby support going to look like? What's ER support going to look like? And so really helping those coaches to work with their teams to create what does your unit want and what do you want it to look like? we're building in workshops, we're building in, like, we have to round on patients. Well, can we round on the nurses and make sure they're caring for themselves? Do they need anything? We can catch those real-time mindset things, like, do you really need to answer every single phone call? Like, even though you're trying to start an IV, like, do you really have to know? You know? So it's a good way to kind of catch those habits and patterns and behaviors that, like, we can talk about all that in coaching, but okay, old habits die hard when you're in the moment. But if you see in your rounding, hey, remember we talked about how do you want to be accountable? What's going on? So really helping them help themselves.
And I love that you're translating all of the coaching techniques into the language of the nurse. And you're also making sure that whoever is doing the coaching is able to speak that same language to that very specific type of nurse in that specific type of environment. And so, Nicole, I mean, all of this that you're describing now kind of fluently and nonchalantly, and it's rolling off your tongue like it was all so easy and natural. But I mean, what you're describing is identifying that there was a huge gap, right? There is a huge problem that the nurses were facing and that therefore was detrimental to the hospital system as a whole. You know that, you lived it, you breathed it because you were part of that problem as the nurse who was experiencing that. You were able to understand and visualize that and then speak that in a very relatable way to the higher ups, right? To your managers, to leadership, to the CNOs, and speak their language in order to demonstrate to them, some of those key indicators, right? If we don't change this, what's going to happen to our patient outcomes? What's going to happen to our nurse retention and our turnover? And then you were able to pose a solution, right? So I've been through this training. I've got nurse coaching. Here's how it's going to be a solution. You got them to say yes, get their buy-in, do a pilot program. You collected enormous amounts of data and survey to find out, like, is this something, is this what the people want? And the nurses were like, hell yes, this is what we want. You took that data back to the higher ups. You demonstrated that to them. Now they're wondering, how can we get grants? How can we get more money? How can we get more nurses? How can we pay for them to get certified? How can we expand? I mean, like, mind blown here, Nicole. This is truly so awesome. And I'm hoping that, like, for any nurse coach who had that semblance of interest but wondered probably, is this possible? I hope that listening to you is shining some major light on what's possible. This is a huge accomplishment to be breaking in to the system in this way.
Yeah, and we are a 16 hospital organization, and right now we're kind of like, my specific hospital is part of like our west kind of region, and so we just got approved for next year. More grant money, and we had a collected a list number 2 of interested employees who want to become certified too. So it's already growing, it's already expanding. We've had, hearing from all around the different hospitals within our system. So like people have heard about it, and so our plans are that either this year or next getting this up and running in at least 2 other hospitals. So, and my director is transplanted into our East region. So she's already strategically trying to, plan and sneak in there. So it's amazing to have been able to at least bring some hope back. I have a million stories that we probably don't have time to get into of how, real time, like how really spending that time with that nurse then like was not somebody who would have like spoken up before had done that. And then there was like provider patient, repair that happened because of a decision to like not do what she'd always done, but say, you know what? I need to say something to this physician. Did it. Hey, if you don't, it's probably never going to be aware. And what an opportunity. A lot of us kind of clean up after doctors sometimes, which they come in and say, and they're emotional. We have to emotionally calm them down, and it's time consuming. But she was able to do that. And it was just amazing to witness that moment and just how it, the patient's like, oh my gosh, I can't believe he came and apologized. Like that's repair right there. That's relational repair that you've all kind of experienced too, where a patient's frustrated with the doctor and then they don't want to do what the doctor.
These are small wins that have such a huge impact is what you're describing here. I love that. So Nicole, you are celebrating expansion, right? From one wing to the next, maybe from one branch of the hospital to the next branch. I would like to celebrate something else by reading something that you shared prior to this podcast. And it just speaks to the incredible work that you are doing and kind of where you're going and what's possible here. And so before we close, I just have to read this out loud. You wrote, I am determined to establish nurse coaching departments in every single hospital, rehab, and outpatient center in America. And I need the help of our fabulous nurse coaches who are up for the task and feel the inner call to bring it to their area of the country. I know those nurse coaches are out there. I also want to give hope to the many burnt out nurses that change is coming and they don't have to give up on their nursing careers. Nicole, I had to read that because I think it so beautifully describes the impact of the work that you do and really the tremendous mission that you are on. Is there anything else aside from that awesome statement that you want to speak out into the universe for the nurses and nurse coaches in our community to hear before we close things out?
I never in a million years would I ever think that I would ever be doing any of this right now. So, as a testament, anything is possible, even if you don't think that there is no way or that you could even dream of it, because this was not even a thought in my head going through the collective. Not even a little bit. But how it just transpired as you're taking one step forward, you don't know where you'll end up. It's exciting. It is kind of like not really knowing what you're doing, but going with it and seeing things just come forth. You don't know how your life will be different in a year from now. But if you have a dream or a goal or a vision and you just start moving towards it, it will become more defined and bigger and bigger. And pretty soon you need a team.
Yeah. And isn't that how nurse coaching works? We take those little impossible dreams that you can't even really think up in this moment. And somehow we dream the impossible and then we create the impossible. And then it just keeps on building and expanding from there. Nicole, I love getting to hear about all of the awesome work that you've done. Thank you so much for being here and for sharing and for being an inspiration of all that is possible. I wish you the utmost best of luck in your expansion, and please keep us posted. Maybe 1 year from now, we'll have you back on again to hear how everything has changed.
Thank you, Heather.